What information is typically required on a completed laboratory requisition form? And in order to properly answer this question, we need to understand what the requisition form is referring to. Because if we look at the choices here, we see all different types of information. If you see option A, it has to do with like the environment of the lab itself. Option B has to do with patient information. Option C has to do with more the insurance and the physician and about the appointment itself. And then option D has to do with about the lab technician, about the equipment used in the lab. And now the way to properly go about which choice to use is to understand what are we focusing on a requisition form. Are we focusing on information about the lab? Is a requisition about lab information? Is it about billing? What are we focusing on? And requisition would be what you're obtaining from the lab for patient, for the patient diagnostic information, or for just the patient's health information based on the specimens received. So for example, if you request from the lab a CBC results, that would be your complete blood count, and then you'd have your CBC, and then it would have a list of all the results of how the patient's blood, what came back, what was high, what was low, what numbers we have, and it's all of the results of this patient's specific information for their blood test. So now let's think about it. If we're trying to find information from a patient's lab based on their specimen, their blood values, and it's all of their personal health information, do we think that the room temperature, humidity, and time of day is important? No, we want to focus on the patient information. Option B says patient demographics, the test required, date, and time of collection. Does this seem like information we would need to know if we want to obtain a patient's blood test, for example? And yeah, we would need to know the patient has the correct name and birthday on the lab to make sure this belongs to them. We want to know what test we're looking for, in this case the CBC. And we want to know the date and time it was collected so we can compare with other tests from the past and again in the future. And therefore option B is looking like a good choice, and we will go with it. But let's take a look at options C and D so we understand why these are incorrect. Option C says the physician diagnosis, the insurance information, and the appointment time. Now this is missing a lot of crucial information here. If we want to make sure that this is actually the patient's lab specifically for them, we need to know their demographics. We need to know their birthday and the correct name and all of that information, the MRN maybe, and all of that is missing in option C. Also, the insurance information and the appointment time really is not relevant in this example. So therefore, option C is not a good choice. Now for option D, if you misunderstand what a lab requisition form is, you might incorrectly think that the lab technician initials or the equipment used is important. However, we're not focusing on that. We're focusing on the patient information in this case, and therefore option D is incorrect. And that leaves us with option B. The patient demographics, the test, the date and time is definitely what's needed in the case of a laboratory requisition.